it's CJ. Welcome to week 21 of your pregnancy. Today I'm going to tell you what's happening with your tiny human, some of the more common symptoms that you might be having, what you can do to alleviate some of those symptoms. And if you stick around, I will also tell you what you can expect regarding fetal movement. At this point, your little one is now measuring about 10.8 inches or 27.4 centimeters from the top of their head to the bottom of their feet, roughly the same length as a carrot. He or she now weighs about 14.1 ounces or 400 grams. The heart continues to beat 120 to 160 times per minute. This week, your baby is very busy sucking his or her thumb. The taste buds are continuing to mature, and they can now taste the flavor of the food that you're eating in their amniotic fluid. And finally, within the digestive system, meconium is starting to form. You'll get a really good look at that meconium when your baby takes its first. So here are some of the more common symptoms that you can expect to be having now that you're 21 weeks pregnant. Number 1, varicose veins, especially if you're on your feet a lot. What can you do about them? Try to exercise on a regular basis. Elevate your feet above the level of your heart a couple of times a day. Avoid crossing your legs or your ankles. And finally, compression socks can really help. Number 2, every time you brush or floss your teeth, your gums bleed. So what can you do about that? Make sure you're brushing twice a day and flossing every single day. And ideally, get an appointment with your dentist to have your teeth cleaned during your pregnancy. Your dentist is probably going to require a note from your OB saying it's okay, so be sure to ask for that at your next OB visit. And after you have your baby, you're going to want to schedule another cleaning after those gums start to recede. Number 3, you might be a little clumsier than you normally are. As your uterus is growing, it's throwing off your center of gravity. So what should you do about that? Be careful. Wear flat-soled shoes and try to avoid situations where there's a potential for a fall. Number 4, the ever-present heartburn. As your uterus is growing, your stomach capacity is shrinking and you have more stomach acids. So eat small, frequent meals throughout the day. Avoid foods that are greasy and or spicy. Don't lay down for 2 hours after you eat. And if all else fails, talk to your OB provider about getting medication that can help with that heartburn. Number 5, more Braxton Hicks contractions. If you're noticing a lot of cramping, I recommend emptying your bladder, get off your feet, and drink 32 ounces or 1 liter of water. If the cramping continues, you've definitely got to let your provider know. Number 6, your fundus or the top of your uterus is now located about 1 centimeter above your belly button. If you're carrying twins, it's probably more like 2 centimeters above. And finally, let's talk about fetal movement. By 21 weeks, most moms are feeling some flutters. However, if you're not feeling fetal movement yet, please do not worry. Every baby is different, and a lot depends on where your placenta is located. If your placenta is located in the anterior or the front part of your uterus, the movements are going to be much subtler and harder to feel than if your placenta is located in the posterior or the backside of your uterus. Some babies move all day, some only move at certain times of the day. So when do you get concerned? If you are not feeling any movement whatsoever by 24 weeks, please let your provider know. So do you have any questions regarding fetal movement? If so, I do hope you'll leave those in the comment section below. And while you're in that comment section, I would sure appreciate it if you'd hit the like button or even feel free to share this video. Hello, it's CJ. Thank you so much for watching the entire video. I truly do hope that the information has been helpful. When I make these videos, it is not meant to replace a visit with your healthcare provider. Rather, my hope is after watching my video, you know what questions to ask your provider at your next visit to best meet your own healthcare needs. In the meantime, if there's any questions that I can answer, I hope you'll reach out to me. And finally, if you have not already subscribed to my channel, I'd really appreciate it if you did that. That's all I have for today. This is CJ, and I am at your cervix.